Hello, beautiful people. Before we begin, take a deep breath in through your nose and exhale gently through your mouth. Let your body soften. Let your mind settle. You are safe here. You are home. Welcome to Our Body and Mind, a safe, open, and compassionate space where women's health meets real conversations that heal, blending expert insights with heartfelt stories. I'm your host, Dr. Tammy Lawson, aka Dr. Tammylicious. Yeah, we talk about the challenges, the science, and the silent struggles women face from puberty to menopause, from reproductive health to mental and emotional well-being, and everything in between. Today's episode is a powerful one because adolescence is not just about growing bodies, it's about becoming aware, becoming curious, becoming self-conscious, becoming confident or uncertain. Today, we're talking about body image, sex, and mental health in adolescence. Conversations many of us never truly had growing up. I'm joined by an amiable professional who will help us see the full picture, body, development, and mind. Dr. Miriam Iwanika Ike is my guest today. You're welcome, Dr. Miriam.
Thank you very much, Dr. Tammy.
Dr. Miriam Iwanika Ike is a certified mental health counselor, social and behavior change specialist, and public health officer. She is the head of operations at Epic Consult Clinics in Abuja and the founder of Health Info with Memes, where she uses storytelling to promote mental health literacy and reduce stigma. Her work centers on client-centered, trauma-informed, and culturally sensitive care. I call her Dr. Memes. Dr. Memes, thank you for being here.
The pleasure is all mine.
So let's dive in. Let's talk about body image and self-esteem. Growing up, many girls experience a quiet shock the moment their bodies begin to change. Breasts start to form, hips widen, skin changes, height shoots up, weight shifts, voice mature, hormones rise. Menstruation begins, emotions intensify. And suddenly, the body they once lived in without thinking becomes something they constantly notice. Not because it's wrong, but because it's changing. And in that change, many girls begin to question themselves. Society doesn't always make this transition kindly. Comments are made, comparisons begin, beauty becomes measured, worth starts to feel conditional. Dr. Mims, to start us off, how would you define medically and psychologically adolescence?
Well, I would define adolescence medically as a stage where the body starts to develop producing hormones which affects the production of certain or changes in the girl's body. The sexual hormones start working on the body. We're on set. I might not want to use the very big terminologies, but certain hormones are released which make the girl start having things like breasts. She might notice that pimples start breaking out on her skin. She would notice that her hips are getting bigger. There's fat deposit in certain parts of the body, and fats are being deposited in the hip, the buttocks, and the breast. So she noticed things like that medically. And then the height, there's this rapid growth. You notice that girls that looked shorter have started looking tall. They develop, maybe I'll put the bottle shape that many people would say. You find out that they start having that figure, and everybody's looking at them. They were once seen as just that girl. Now people are seeing them as, oh, you're becoming a matured girl because that figure is there medically. That is what happens. And then psychologically, this is when they now become aware. There's a certain level to which they want to belong to society. There's psychologically, they find themselves asking, is something wrong with me? Am I enough? Is am I not strange? This is not what I used to be before, but now I'm looking different. So what's going on with me? They are becoming quite aware of themselves. They are sensitive. I think I'll use the word sensitive. They become
Okay,
more
more
sensitive
sensitive.
to things around them. The difference with this stage is that they are very sensitive. They take actions without thinking. So psychologically,
Logically.
they are taking actions. They are very impulsive, but there's not that stage where they sit down and relax to think about what they are about to do or what they're about to say. So they just take actions without thinking.
Okay, so but why is it that this stage they are really sensitive about their body image?
Oh, yes, they are very sensitive about their body image because there's a part of the brain which is more active, which is the prefrontal cortex. It is what is responsible for pleasure. And that part of the brain releases hormones which make you just act, which makes you sensitive to anything. So, that part of pleasure makes you want to just enjoy yourself. If you're not enjoying yourself, what happens to you? You become quite
Waiting you
sensitive.
gain.
Exactly. Wait till you gain. I think I like that language. So they are at that point or that stage where they feel, if I'm not getting what I want, then there must be something wrong. And then you find them either withdrawing or they start throwing some kinds of tantrums.
Tantrums.
They just want to be pleasured at all times. And that pleasure, it might not just mean maybe like dancing, eating, singing, and stuffs like that. It also involves them feeling like, I need to look a certain way, I need to speak a certain way. So if they are not getting that satisfaction, it makes them very
So they
sensitive.
start feeling beautiful.
Exactly.
Okay, thank you for that insight. Let's talk about adolescent development and identity. Before sex even enters the conversation, something deeper is happening. Girls are forming their identity, they are learning how to regulate emotions, they are figuring out who they are and who they are not. This is where development matters. So, Dr. Mims, why do adolescent girls struggle so deeply with comparison, belonging, and identity during this stage?
Yeah. They struggle with it. I mentioned something earlier. They're impulsive. And at this stage, they just want pleasure.
Okay.
They just want satisfaction. So they are struggling with they are struggling with getting a balance. In psychology, there's something we call the id. That
Yeah.
is the primitive nature of the
Nature.
person. We have the ego and the superego. So at this stage, they are the primitive stage of life, and that primitive stage of life. Um, let's take a baby now. When a baby is born, the baby just cries, wails, and once you put the breast in the mouth, what happens? He stops crying. It's just that pleasure. And the baby doesn't understand anything aside, just put the breast in his mouth or her mouth, and then he's satisfied. So at this stage, they are like babies. They are maturing into adulthood.
They are
It's a
becoming
transition between childhood and adulthood.
adulthood.
Is that mid stage? So now this mid stage is a stage of confusion. It's more like, I'm sure I'll even start with your program now. When you were starting off this program, it felt like a means to should I say a dead end at some point, because you had a vision, but the whole thing around this program was like, oh my God, am I ever really going to get to the end? Is it going to be a success? So at this stage, they're asking themselves, am I going to be a successful human being? Am I someone that people would see and admire? So they're struggling with a lot of things. And at this stage, like I said, what is really involved is at the prefrontal cortex, where everything that happens to them is just like they are just impulsive, just doing, just doing. They don't sit down to logically look at it and say, okay, this is the way it should be. So now they are struggling with people identifying them as this. So this particular stage is a stage where they just want to be seen. Social media confuses them, peer group confuses them. They don't have an identity yet. Just like I said, when you were starting the program, you were looking for an identity. You wanted a means to an end. So they are looking for a means to an end. They want to be known as that hot chick, Now I'm looking at the television. What's the name of that lady that does these robotic things on television?
Okay, is it Jarvis?
Jarvis. Now, every teenage girl looks at Jarvis and they're like, oh, I want to be like Jarvis. I want to have money. But they do not know the struggles she had to go through to be Jarvis. Everybody just wants to transition into Jarvis. So they are not thinking. At this stage, they are looking at, let's say, I don't know who I would call that is a female musician that is of their level, or maybe an actress. But once they see such people, they are influenced by their looks, by
The
the way
model
they,
after
yeah,
them.
exactly. There's that modeling. Now they selectively choose their models. They might be choosing them based on peer group. They might be choosing them based on what they think they want to be like. So all these things around them make them struggle with identity, and then they want to just be like them. So it's just a stage of confusion. I would say it's confusion in the real sense, but it's a stage of trying to identify.
No, a stage of confusion. I
Yes,
think that's a
it's
better term for
for
it.
it. So it's
Yes.
just them trying to identify who they are. And once
Yes.
they identify who they are, it helps them through adulthood. So that's the reason why sometimes you see them being drawn back. Sometimes some of them even want to struggle with the fact that they are let me call it inferiority complex. They start having inferiority,
Yes.
and then they start
Affects their
struggling. Yes,
self-esteem.
esteem. So once their self-esteem is being bruised, it's either they withdraw or they become bullies because they don't want you to see their deficiencies
Yes, I
somewhere.
was bullied, like bullied in primary school. Really, really bullied.
Oh, wow, I
Yeah.
can imagine.
Yes.
Yeah, I think I used to be bullied at some point because
Yes,
I'm a
because
crybaby.
I was really naive and
Yeah,
really
so
quiet. So
but when
yeah.
I looked at some certain people, I used to be the school's MC because I knew how to talk. So I realized, oh, talking was kind of like, oh my goodness, I could get anything I wanted when I spoke.
I
So
wasn't talking at all.
I used speaking to throw away my own differences. But I know for a better part of my teenagehood, I was withdrawn. I was really, really withdrawn. I felt I wasn't just like every other person. So I was really withdrawn. But once I got my voice, I felt I could use my voice to intimidate anyone. So I used my voice as a weapon, though there was still that inferiority behind if you looked through.
So what made you think that you were different from every other girl?
Well, yes, to start with, my growing up days was, I think I am more confident now to speak and tell you that I have a condition known as PCOS. And this condition makes us develop faster than our peers. So, as at the age of 5, I was already having pubic hair. So, you can imagine that fast development. And then, when I even got to 8, I was already menstruating. So, I menstruated earlier than my peers.
8 years.
Yeah, so as at the time I started menstruating, you wouldn't believe when every other person was menstruating. I had secondary amenorrhea. I was no longer menstruating. So I felt like I was just a different person entirely. So you can
I
imagine
can
where
imagine.
those you feel you
started off before, you've already stopped. Are you menopausal now? What is going on? Every other person is
Yes.
menstruating and you're not
You ask
menstruating.
yourself, am I normal?
I remember I used to wear pads whenever I saw people wearing pads just to pretend I was menstruating.
Really?
Yes. So you can imagine that level. I was model, or I saw other people and I tried to make them my own models. You understand? So I was trying to do things to fit into what society felt was right. Even though whenever the period was about to come, most times I stained myself because I didn't have a cycle. I couldn't track when it would come and when it wouldn't come. So I would find myself sometimes staining myself. Now I was wearing pads when I wasn't menstruating, and then I wouldn't be with a pad when it starts. So you can imagine
It's
the
an irony,
shame, the
yes.
irony. So it wasn't really, really nice. And then, for
Yeah.
someone who developed pubic hairs on
Oh
time,
dear.
oh
Can
my
imagine.
goodness, I felt like I was a monster. Because then I had seen movies, I had seen how clean girls' skins used to be, but mine wasn't. God, who created me? Where did I come from? Now I had inferiority complex at its height. I couldn't stand being in the midst of people because I felt, how can a monster be with people? I didn't want to be with anybody. I just wanted to be on my own. So, I could hide, and when it's time to eat, I'll try to eat, but God help me, I was on the big side. So even when I tried to eat, everybody called me fat. So I stopped eating at some point. So you can imagine what I had
I
to
can
go
relate with that
through.
body shaming.
Exactly. So it wasn't really, really such a nice one. But I would say maybe development came into, because once development comes, at some point you tell yourself, I can be better than this. I'm sure you'd notice that sometimes you sit down and then you're thinking about yourself, and then somehow you say, I can still be better. Most especially when you see somebody you think you can model after. You see someone who speaks like you, behaves like you, but is doing better than you. You tell yourself, if this person is like this, then that means I can also be
Be
like
and
this.
even
So,
better.
exactly, or even better. So, somehow you pick up yourself and then you dust yourself and you move on. So, I think those were some of the things that helped me. So, I can say at this stage, modeling is one of the easiest ways to either make or mar an adolescent.
Wow, thank you for that passionate story about your teenagehood.
Thank you.
Thanks for sharing.
You're welcome.
Dr. Mims, teens' impulses and emotions can feel really overwhelming. What emotional regulation and confidence building skills should girls be learning at this
At this
stage?
stage, first and foremost, as counselors, there are certain things that I feel every human being should practice, and that is being calm, breathing in and out. It helps a lot to calm your nerves. It helps you to even reset your brain and sometimes to ask yourself questions. Do I really need to be this impulsive? Do I need to be aggressive about things? Do I need to be emotionally down or deranged about this? So it helps you to really, really have, a calm disposition about yourself. So when teenagers are having a burst of emotions, just like I said, the breathing in exercises help a lot. It helps to calm them. Another thing that helps, if teenagers can help themselves with exercises. Exercise is, our emotions deal with our physical as well. If you can engage in activities that help you move your body, most times you get this burst of energy that makes you satisfied with yourself. Just imagine yourself waking up in the morning after your prayers,
You breathe in and out, you stretch your body. You know, just a little stretch makes you feel like you have actually exercised your body.
Yeah.
And it gives you that confidence to move on. For those who can take it a step further, after they've brushed their teeth and done every thing, their activities in the morning, they can go out for a jog or something, you know, a walk. It helps to bring calm to the body. Honestly, ask people who exercise, they will tell you they have that confidence. It helps to regulate their emotions, it helps to regulate how they think people see them. You understand? So, exercise has a it's a good therapy in
Yeah.
helping to
Sorry to,
cut me short.
yes. So I don't know how many teenagers actually exercise. And especially during the school season. So while you were talking, I was just thinking, the school rush. We call it school runs,
School
right?
runs,
Yeah. So the
yes.
school runs rush every morning, Mondays
Yes.
through Fridays. So I was just thinking, what time would a teenager have to,
To actually
because
exercise.
your mom is waking you up, or your parents, that your mom or dad is waking you up, or you're we're always in a hurry.
You know,
So sorry. So
yeah.
I think you, at this point, you should also bring in the parents and speak to them.
I was actually going to say that before you mentioned it. I was going to say at this stage, they're still under their parents' care, except for those who, quite unfortunately, might not be with their parents and have to fend for themselves. For those who need to fend for themselves, they need to create time to exercise. For those who have parents, because I can tell you that this is an era of social media. So both those that have parents and those without parents would actually see this podcast. So, for those with parents, you know, we are the ones who help to shape the individual to whom they will become in future. We guide them. At this stage, they need us even the most because, like I said, this is a stage of confusion. So they really, really need the most guide they can get. So just imagine me as a mother, because I think I have, in quotes, a lot of work to do. And then I allow my teenager just to live his or her teenage life just like that. My God, I'm killing the child. The child might grow up with a lot of bad tendencies or bad characters that I do not know. So as a mother now, and as parents there, as for many that are listening to us, I indulge you to help to shape your teenage life. First of all, it starts with you. Let them see you as the model. If you as a parent wake up in the morning and they see you doing some stretches, it's easy for them to model that character. But when you're forcing them to do something that they do not see you doing, it's quite difficult for them to actually do it. They'd
Do as
say,
I do.
exactly. Kids, when they are growing up and you're singing, do as I do, they're excited. You think teenagers do not like it. Yes, I know sometimes they'll say, we don't want to live like these old men, because at that stage they feel you're too old. You don't understand what Gen Zs are talking about. So they wouldn't want to listen to you. But once they see you modeling it, and then you're telling them, oh, see, my shape is looking good because I'm exercising. I was able to use the toilet. I'm not constipated because I've been exercising. It's sticking in their heads. Now, if you tell them that I think we need to exercise, we need to do some outdoor games, we need to do this, maybe when you're done from school, another thing is to encourage them. Schools have activities, right? Most of these teenagers are in secondary schools. Most secondary schools have after school activities which involve exercising their bodies. I can bet you, if we take statistics of people who engage in this external after school activities, sorry, you find out that they tend to be more fulfilled in themselves than those who do not. During my sessions, my counseling sessions with some of my clients that are adolescents, I've come to find out that most of those who are having issues usually want sporting activities. they go as far as asking me to let their parents know that they want to be engaged in sporting activities.
Extracurricular
Yes,
activities.
exactly. So now, if they are saying this, what does it tell you? It helps to boost their image. It helps them feel like I can be better. It gives them that sense of wellness, that sense of acceptance. They feel good about themselves. So if the teenager is feeling this way, it's a good step, because the teenager tends to grow up with something that is even a um, good thing that would help their lives in future. You understand? So I think even schools have been able to put in that exercise that I'm talking about that helps with their self-esteem.
Esteem.
You understand? So exercise is one of them. Another thing is self-awareness. Like I said, this is a stage of confusion. They are trying to identify who they are. Yeah, they try to model after people. They listen to peer pressure. But at this stage, like breathing in, breathing out, it helps them sometimes to realize that, oh, if someone kicks me on the leg, I get very angry. And you find out that they start trying to avoid being kicked on the leg. And for those that are vocal, they find themselves always saying, don't kick me on the leg because I really get mad. Now they're becoming self aware.
Aware.
So self awareness helps to reduce this stage of them not being able to control themselves. All those tantrums that they throw, all those being uncomfortable with themselves. At this stage, if they can practice self-awareness, it helps them to control
For
themselves. So I
themselves.
think basically exercising self-awareness, modeling, like I mentioned, parents should help to model the right things to their kids. They should also help to checkmate the kind of people they interact with. Like some children wouldn't want to be found in the church. They'll say, "You're making me to churches," because of the kind of peer groups that they find themselves in. But do you know, I can actually be taking my child to church, but there could be some kind of partying that they do in the church. Okay, like I'm a Catholic. And I know as Catholics, we celebrate the Valentine.
Okay.
And we have a way of celebrating Saint Valentine's Day.
Okay.
And we do it also for the youth and for the adolescents, the children. We try to involve everyone. And now we make it in such a way that it looks party like. Now, as a parent, I would be intentional to make my teenage children attend such parties where they find their pairs. Now it's in a controlled environment.
Environment.
There are certain things they are exposed to other than the other one that they might model when you allow them to be exposed to things that you do not even want them to be exposed to. Now maybe there's a trivia, there's Bible quiz, but they are doing it in such a way. Now if maybe they put a bottle in the middle, and then everybody, you're shouting the names of different verses of the Bible. I'm sorry, different books of the Bible, and then they are running around the bottle, and they say the person who says it last should pick the bottle or something, stuff like that. It's fun for them. They find themselves being accepted by society, right? If you could say, okay, this person you're going to read, you're going to act as the model, you're going to act as this, you're going to act as that. It gives them some sense of, oh, belonging
In
and
other words, they should be involved in religious
not
activities.
just religious, but there
No,
are
in addition to what
exactly,
you have said earlier.
just good cycles. There are, like, how would I put it? Those who are coming out of drug addiction now. That's, by the way, I'm just saying something. You can't say they must be in a religious group. There are some cycles where you find people trying to come out from drug addiction, and then they find themselves having this, okay, a community of people who were once drug addicts. They sit down together, they encourage themselves not to go back,
Support group.
support groups. So there are some sort of groups that are like support groups, but in this sense they are not, in quotes, support groups, but they are groups that can help your adolescents see a better version of themselves. You understand?
Okay.
Or that, like, okay, if I decide that I will take my child to learn swimming with a group of people that are serious minded who just want to learn how to swim, and then she finds herself swimming, she's competing, now it's giving her a good sense of self, right?
Yeah.
Rather than just allowing her with her peers. With her peers, they might find themselves in one party where everybody is smoking shisha, doing the wrong things as against, because they need to socialize. Let's be honest with ourselves. No
Yes.
human being is an island. You can't lock up your child in the house. So why not channel their social life into something that
Some
you
of
think
us were
is
boxed.
exactly. Why not channel their lives into something sociable that is, the right one rather than the wrong one. So this helps them with themselves.
Yes. Okay, and while parents are doing this, it should be done without shame or
Or
fear.
fear, exactly. And yes, this even brings me to another thing. Most parents want to speak and not listen. I think sometimes I am should I say guilty of that. Most times we're talking and we're not listening. Sometimes these kids know what you want to say, but they want to ask something that you might not even have thought of. You're not in their minds. You're Dr. Tammy and Dr. Mimi, and there are times you want to tell me something, and I'm like, oh, wait, let me finish because I think I know what you but probably I really do not know what you want to say. And that's how these kids feel. We're on the same level, we're friends, so we're talking, as pairs. But these children want to say something that you've not heard before. If you listen, you would only know what their true struggles are. Don't just say because Dr. Mimi said we should take them to groups where they would be able to find themselves and all. That's all that matters. Sometimes it's not even their interest because we have some children that are introverts and then we have the ones that are extroverts. We have those that are semi intro. That's
Ambivert.
the ambiverts. So
I'm trying
exactly.
to move from introvert to
To an
ambivert.
ambivert, yes. So now you can see that we have different kinds of personalities. But when you listen, you find out that some of their struggles are complete. In fact, there's no two human beings that are of the same, that are alike and the
Yes,
same.
sure.
Everyone is unique. So what they are thinking of is actually different from what you're thinking. So you need to calm down, listen, and then you'll be able to channel their energy towards the right path. The first thing as a parent is listen. Secondly, do not judge them. Because I believe even we as adults, we make a lot of mistakes. A lot of mistakes. We think we have learned, but we're still learning. We're still in the process. Till you lose your last breath, I think we're always learning. And if you ask an old man, he will tell you, I just learned something. So we're always learning.
Learning is
It's
continuum.
exactly. So please, as parents, listen and do not judge.
We
And then
listen, we
we
listen,
listen,
we don't
we don't
judge.
judge. Exactly.
Okay, and then we should, as much as possible, to avoid comparison. And see your
Exactly.
mate, see your this, see your that, they are this, they are that.
This is this thing you're saying, it's reminding me of something that transpired between myself and my daughter. I was talking to my daughter one day and I was trying to tell her that you're much more than what you think you are. And she did something that really, really put me off. I felt she could do better. I was about to tell her, and your sister would not, and I pinched myself. I said, her sister is not better than she is. Her sister is unique in her own way. And this other daughter of mine is also very unique in her own way. So I pinched myself. And I said, no, I know you can do better than this. What are your struggles? Okay, tell me. What is it that is making you do this, this, and this? And she took her time and told me, honestly, if I had not asked, I did not know. So that was when I was able to gather information and then I was able to channel my energy to the right thing. And then I told her, okay, do this and do this. And I was so marveled that it felt like I was scolding her, But when she was done, she said, "Mommy, thank you. I love you." And I felt so good. I was like,
Ah.
"Oh, good parenting."
All
But
right.
there's a struggle, really. We
Yeah.
always want to be right.
So intentional parenting is
Parenting,
key
it's key.
in raising these adolescent
Adolescents,
girls and of
exactly.
course boys.
And boys too.
Okay, moving forward, let's talk about sex, adolescent sexual health. Growing up, many girls didn't have the language or the space to ask questions about their bodies. There was this TV drama series sponsored by UNICEF called I Need to Know many years ago, if my memory serves me right. It talked about puberty, self esteem, and sex in a way that felt honest and human. That program helped, but it was often the only source. Beyond that, no structured conversations at home, no real sex education in school, just warnings. Don't talk to boys, don't get pregnant, be careful. And for many girls, that was it. Though they were overly protected but underinformed, shielded from conversations but exposed to confusion. So they figured things out on their own through whispers from friends, through movies, through social media, through trial and error, and sometimes through mistakes that could have been avoided. Mistakes that affected confidence, boundaries, mental health, even life direction. This is the story of many women, me included. Girls trying to make sense of their bodies, emotions, desires, and fears alone. Girls with questions but no safe adult to ask. Girls who carried shame instead of clarity. If that sounds familiar, let me tell you this: you are not alone. You were never foolish, you were uninformed. That is why we're here, to break the silence, to replace fear with facts and shame with understanding. Let's talk about sex, not in whispers, but in truth, from a health, safety, and dignity perspective. Silence has never protected girls, information does. Dr. Mims,
Yes, please.
why is fear based sexual messaging harmful compared to age appropriate education?
Now, while we were growing up, when we started menstruating, what did our mothers tell us?
Don't go close to boys.
Don't
Don't
go
talk to boys. Don't even
exactly
stand.
close to a boy. If you do, what would happen?
You get pregnant.
Simple. So even breathing in, just perceiving, the smell of a boy meant that we were supposed to be pregnant. As a matter of fact, the whole ladies should have maybe given birth at the age of 12, let's say at the age of 8, 9, 10, 11, 12, or probably we should have aborted as at that time. So it's wrong to just give that kind of messaging because you're giving the wrong kind of message. And once you give that kind of message, just like Adam and Eve, I'm not saying God did not give. Don't get me
Yeah,
wrong.
I
But you can
know.
see that the human mind.
Yes.
Now, the serpent is the peer pressure that comes in. Your mommy said you should not touch. It's a lie, yo. If you should touch, it's sweet.
Nothing will happen to
Nothing
you.
will happen. You will just have pleasure. You have pleasure. In fact, you want to be doing it every time. In fact, there's even one working class that I have been meeting recently. You're only 12, but you're already having interactions with someone that is a working class. You say, there's this my uncle. He comes to see my dad in his office. And whenever he comes, the both of us go into the toilet. He buys sweet for me. He buys ribbons for my hair. He does this, he does that. And when we go in, it's not, it might sting at the beginning, but once it starts you're having pleasure all through. It's sweet too. Try it. Don't mind your mom. You won't get pregnant when they touch you. It's sweet. Now, this person is already looking at the fruits. They said it's a fruit of good and evil. Everybody knows sex is good. when you're doing it appropriately. But when you do it wrongly, what happens? There are repercussions. You understand? Unplanned pregnancies, STIs, it lowers your self-esteem. Not to forget, what do you call it? This, jeez, why isn't VVF?
Okay.
Vaginal
Vaginal.
fistula. So, not to forget that, because most of these girls, if they get pregnant and then decide to give birth, most times it leads to VVF.
Yes, yes.
So, the consequences are more. So it's best we have age appropriate messaging to these girls. Why not say something like, okay, let me use myself. Miriam, I know you have started menstruating. I know you have gotten to that stage where your body would start feeling some sort of way. It would want to be with the opposite sex. It's natural. Validate their feelings. Don't ever make them feel like what they are feeling is of the devil. Because I've seen parents who take their children for, what do you call it, deliverance.
Deliverance.
They've been possessed. But the person taking you for deliverance once felt that same thing. So that means you were once
If
possessed.
the deliverer is not even eating the forbidden fruit.
My dear. So why don't you validate the feelings? Because during puberty, because it's during the stage of adolescence that puberty starts, and that is when you start having, for the boys, they have wet dreams, isn't it? They start releasing sperm. And then for the girls, this is the period when their legs are becoming too slimy for them. They can't sit down properly. They are wondering what is going on. And why not validate their feelings? It's a natural thing. God put it there because He's preparing your body for the later life, right? Which is adulthood. If you do not have it now, in future you start running from pillar to post looking for how to get pregnant. Because the joy of every family is when they can have a little child. So now your body is preparing. So once you start having that feeling, it's not bad. It only means that you're growing up to become a woman.
Woman.
Now she feels safe. She feels happy with herself. She looks at the mother who is talking to her and says, "Oh, my mom felt this. That is the reason why she was able to give birth to me. And I'm proud she's my mother." You can see there's a difference. You're validating her feelings. She's looking at you to say, "Oh, yes, you too had this sort of feeling." Because, sometimes during the course of your speech with your adolescents, you kind of tell them what your own experiences were too. It validates their feelings as well. So once she hears that kind of thing, she's looking at you, "Oh, my mom was able to go through the stage." And then when you say, when it happens, is at this stage you're going to battle with this with all the temptations of life, because people will tell you that you should go ahead and try the forbidden fruit. Now, what do I mean by the forbidden fruit? This is the time, this is the stage boys who want to touch you. They want to touch you on your breast. They want to kiss you. They want to touch you on your bum bum. But would you want to be thrown out of school because you have a little child that you can't take care of? Or would you want to finish up from school, get married to a good man, a successful man, and then have your children and be able to take care of them? Obviously, they will choose the later rather than the previous one you had said. So there are certain things you tell them. You tell them, you validate their feelings. You make them know that what they are feeling is okay, but they have to be disciplined enough to get through to the end of it. These are two messages. Now you have even involved the fact that peer pressure would be there. You would also involve the fact that sometimes you might see yourself even having more breasts than your friends, or might not even develop it as fast as your friends. Don't get so worried, because everybody has different ways their bodies develop. But just know that at this point, you might be developing it very fast. It might be bigger than the other person. There are different things that you would see. And do not forget that your counterparts, the opposite sex, which are the boys, are also undergoing this same stage. which makes them very unstable as a volcanic eruption. They want to find a girl to express themselves as well. Just the way you're feeling some sort of way, they are feeling some sort of way, and they want to express themselves. I'll say, let me give you an example. I will show you. Maybe if we have pets at home, we have dogs, and then I tell them, okay, look at that is the mommy dog, but have you seen the baby dog mating with the mommy dog? And she says yes. I'll say it's because they were not able to control themselves. So would you want such a thing to happen to you? And she's saying no. So there are different ways of expressing these things to them. And then they start reasoning, alike with you. And then they say, oh, I don't want to have this, I don't want to have that. It makes it easier for them, to cope with sex at this stage.
Yeah.
So sex appropriate messaging is much better than fear-based
Age appropriate.
age appropriate messaging
messaging
is better than fear-based messaging.
Okay. Um, when you mentioned breast, I wanted to say that I heard that those with smaller breasts produce a lot of breast milk. So not to worry, if your breast is small, your babies will enjoy a
A
lot
lot
of
of
breast
breast
milk.
milk, exactly.
All right, thank you.
Yeah.
So, Dr. Mims, a lot of teenage girls cannot say no to sexual advances. Why is that? And can you encourage us to have the nerves to say no to sex at this stage?
I mentioned one thing before. I said the prefrontal cortex is responsible. It wants pleasure. 2, they are not self-aware. Once they are not self-aware, they are not confident in themselves, right? And 3, wrong messaging. They are not confident in themselves. Okay, just like I was saying something, I said I was talking to my daughter and I noticed some certain things. What I noticed is she wasn't confident in herself. So I was trying to pull her out of that lack of confidence. It still boils down to the parents. Like, when I was talking about age appropriate messaging, I was trying to make them see that they are not different. They are not less of themselves. If you encourage these girls to know that they are not less of themselves, it's easier for them to say no. But when you give them fear-based kind of messaging, or you allow them to get knowledge from, outside, it's easier for them to just, fall for anything that is told them. They have that inability to say no. So it's at this stage that we teach girls to understand that no is an answer. Most people would say, I don't want to hear no. We parents, we're defaulters, yes, we're faulters, right? When we are talking to our children, I said you must clean this house, you must do this, and I don't want to hear no.
If I hear pim,
Pim. So we encourage them to feel that no is not an answer, it's not an option. I wouldn't say we should remove that entirely. No, but we cannot remove it entirely. But at this stage, when they get to this particular stage, this is the stage when you need to be conversational with your kids rather than confrontational, right? If you're confrontational,
authoritative.
yes, authoritative. If you're authoritative towards them, they find it difficult to find their voice. But when you're conversational with them and you say, I don't, um, I wouldn't get mad at you if you say no, or if you have a different opinion, we can discuss about it. Now they see that there is no as an option, right? But if you tell them that my word is law and it must be done this way or that way, you find them seeing it as anything that is being told them is a yes, yes, yes. So this is the stage when they are supposed to be self-aware. We help them to become self-aware. And because we're helping them become self-aware, they can easily say no
No.
to anyone who is trying to force them. And like I said, psychologically and even medically, at this stage, like I said, they are not really developed. They are still at the stage where their bodies are telling them to just receive pleasure. So anything that feels like pleasure to them means they wouldn't say no. But once you have told them this, and these are the steps to take, they can say
Yes.
yes or
So
say
they
no.
have the right to consent.
Consent, exactly.
Okay. So, like you and I know that in this Gen Z era, a lot of adolescents are engaging in sexual activities. And like you rightly mentioned, some of the consequences for early sexual activities. So I was just thinking, what age is appropriate for girls to start having sexual involvement?
Involvement.
Yes.
Well, I like to be very cultural sensitive in everything that I'm saying. Medically speaking, a girl can start sexual activities at the age of 18. Though some people would say 16, but I would say 18 is most appropriate because at this stage, they would have been able to, they are almost at the end stage of adolescence, and they would have started learning how to control their emotions. They are not just acting, but thinking before acting,
Acting.
right? So at this stage, they can actually give consent to whatsoever they are doing. But once they are below the age of 18, they are still acting based on impulse. Anything they just want to do, that pleasure that comes to them at all times, they just want to, do it and release themselves, right? So, medically speaking, like I said, 18 is the age which is most appropriate for a girl to start involving herself in sexual activities.
Activities.
But culturally speaking, for some places they will say 16. But I would advise that for 16, you still need to watch that girl properly because most girls could come down with some of these girls could come down with VVF, and then it leads to a lot of complications, and then the girl would lose her self-esteem. She might not be able to move on with life. Some of them start having suicidal ideations, because of what they are feeling. So I think the best stage, like I said, medically speaking, is at the age of 18.
So this is saying no to child marriage,
Marriage.
right?
Exactly. This is saying no, no, no. A no, 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 no to
To
child
child
marriage.
marriage. Okay, thank
Exactly.
you very much.
You're welcome.
I'm having a good time with you. Okay, moving forward. If this conversation is bringing up memories, take a deep breath with me. Let it out. Let's continue. Teenage girls today are carrying more than we realize: academic pressure, identity pressure, faith pressure, friendship pressure, digital pressure. The pressure to appear perfect even when they are struggling inside, and the pressure of not disappointing parents. Some feel overwhelmed, some feel alone, some shut down emotionally, some battle anxiety, some slip into sadness without knowing why. Let's talk about mental health. Dr. Mims,
Yes.
how does body image affect a teenage girl's self esteem and mental health?
Body image goes a long way to affect your mental health. Not just for teenagers, I think everybody, absolutely everybody. Just like I said, at this stage, they begin to model people and then they want to be like certain people. So once a girl identifies someone that she feels she wants to look like, and she doesn't look like that person, there's that tendency that the girl would lose herself. She starts struggling. This is the stage where people start having eating disorders.
Yes.
You understand? Just because they feel they are on the big side. I want to use all those very big words, for people to understand, like the anorexia is where somebody actually eats everything that comes his or her way. But after eating it, puts the finger in the throat
To
and
throw up.
vomits everything that he or she has
You
eaten.
binge eat and then you intentionally make yourself to throw up.
Exactly, so that you wouldn't put on weight. But the problem with this kind of in quotes,
And while the other one is you don't eat at all. So that's
exactly.
anorexia
Never.
nervosa. So let's break it down, guys. Anorexia nervosa is when you don't eat at all because you want to be slim or thin, because you have an unrealistic body image or body ideal, unrealistic body ideal. And the other, anorexia bulimia, is when you binge eat, you eat and eat and eat everything
that comes your
way, and then you intentionally make yourself to vomit, and some go as far as making themselves to purge.
Exactly. So these are the feeding disorders that most of these teenage girls go into. And then when you see them, they look pale. In fact, even the body is not able to pass through puberty properly. Some of them go into secondary amenorrhea. That's they stop menstruating because they have even lost what do you call it? Their PCV is low. That means their red blood cells are low, and they start having a lot of health challenges, which they do not even accept are health challenges. They just feel that they are okay. You understand? Some of them start having sleep disorders because now they are mentally thinking that so many things are wrong with them. Why don't I look like this person? Why don't I look like that person? In the process of not sleeping properly, they start having anxieties. From anxieties, they go into depression. From depression, sometimes they go into hallucination, and before you know what's happening, they're having psychosis. So all these are things that happen when someone is not happy with the way he or she looks. Like I said, it brings about anxiety. You're thinking, what do I do just to look like this person? And then, for some of them, they start looking for how to get money to do, different kinds of body. You'll be saying this is a teenage girl or this is an adolescent, but it will shock you that I saw a video yesterday online of an adolescent. This child could be 13 or 14, and then he was spraying money at a party. He will go to a bag, he will pull out bundles. He had his friends in a swimming pool, and then they were all dancing, and they had a live band. He'll take bundle of money and he'll fling it at them. So
was this real or AI?
It's real, very real. So if a child of 13, 14 is doing that, imagine what, and that's a boy, imagine what the female will be doing. She'll be looking for money to get her shape in order. So it's that bad that
BBL.
Exactly. BBL. Botox. You know that's what it's called.
Abi Brazilian boot something.
Yeah,
boot lift. Abi butt lift. Brazilian butt lift.
How they can shape their bodies to look like those that they model after. So really, their shapes affect their mental health, and that is when the wrong things are being modeled to them. If as a parent now you realize that your child has gotten to adolescence, and the child is obviously going to be very, very particular about the way she looks, right? It's at this stage mothers tell them gradually, slowly, or rapidly, depending on how your body is, you would start having curves around your body. If you make them see it as you automatically have curves, they start looking for those curves immediately.
And even if you do not have
Have
curves, it's okay.
It's okay.
You're beautiful the way
Just
you
the
are.
way you are. And then you tell them that if you want to even have, if you have excessive of this, some people are not even comfortable with it. If you have moderate of this, you're fine. If you have little of it, you're also fine. The major reason why we have our breast is because we feed our little ones with the breast. It's not for aesthetics as people think it is for. God put it there for us to be able to feed our young ones.
Yes, to
If you
breastfeed
make
your babies.
exactly, and then the reason why it seems most ladies have more hips is because the moment you take in, naturally God makes your pelvis to expand to be able to carry the pregnancy that you have. So that's the reason why it seems like some ladies have developed even more hips. But usually happens when a woman takes in. If all these things are explained explicitly to these girls, it goes a long way in helping them to understand that there are abnormal expectations and there are real
And there are
expectations
times and seasons.
seasons for all of them, and it's a gradual process. So if they come to understand that this is a gradual process, I can bet you that would not become a thing that they'll be so particular about. And then make them understand that most of the times when we even look at our image, we're women here. Let's talk like women. Let's go deep into what women do. Even the Bible made us understand that there will be a time when 7 women will be asking one man to marry them. So why are they beautifying themselves? Is to please the men, right? I'm not saying that you should beautify yourself to please a man. You beautify yourself because it makes you happy. But in a real sense, most times we want to be noticed, right? But do we as women know that men most times are drawn to women who are intellectually sound, who take care of themselves properly, and who do domesticated work well, and who still work in the office space properly?
Are men not asking for too much
You would say,
beauty with brains, with domestic
but skills
skills,
and
and
everything.
then career?
Okay, now I want to say something.
Bros.
You two they too like good thing. Ah, they should
They should calm
manage.
down.
Calm
Farabale.
down. Exactly. Okay, but why I'm saying all these things is we women should understand that beauty, shape, and all that we always look at is not the end of it. We have a lot embedded in us. I'm sitting down here to talk. I'm proud of myself because I have the knowledge. In fact, when I sit down at home with my kids, my husband, everybody's watching YouTube tomorrow or watching TV tomorrow, and my face is there, I'll sit down with my shoulders high. Now, I'm not saying I'm sitting, nobody's even seeing my shape. As a
True.
matter of fact, I don't even want you to see my shape. Let me hide it very well. But now you're looking at me and you're seeing me talk. I'm not reading from the paper. I'm speaking from what I have in my head. It makes me look pretty. It makes me look acceptable.
So what you have in your head
Matters a
is
lot.
better than what you
What
have behind.
exactly
Girls, your head first before your body
body
shape.
shaping. So I think girls should understand that before we even start looking at all those things, go to school, read, do well. For those who might not want to go to school for one reason or the other,
Or who are not
who are not
opportuned.
opportuned to go to school, learn a skill. Do something with your hands. Because I'm a Christian, pardon me. Even the Bible made us understand that we should use our hands that's we use the skills of our hands to do things and we'll be blessed. He said he will bless the works of our hands. So if you want to be a blessed woman, you should be able to do something with your hand, with your brain. Do something to add to society. As this program, Dr. Tammy is actually adding to society.
Thank
God, I
you.
really envy her. If tomorrow
Thank
someone thinks I should
you.
write something on about Dr. Tammy, I'll say it has been crested on the, on the sand of times, that Dr. Tammy is someone that started a program to help people, women most especially, the female gender, to discover themselves. And if being on this program, I'm also discovering myself, because I'm speaking to myself, just like when I say my children, I'll say I'm actually guilty of this. I know it, but sometimes I'm guilty. So it's helping me recall that this is what I should do. So really, the good things you do supersedes your shape.
Thank you.
I think we should take that.
All right. The good things you do should what?
Supersede
Your shape. Thank you very much, Dr. Mims. What mental health red flags should adults never ignore?
Yeah. What adults should never ignore is when you find out that your child is withdrawn. That's the first thing that you should never, ever ignore. Some parents will say that, teenagers like to be on their own, they like to lock up themselves. No. Most times they withdraw. It starts with withdrawal. And after withdrawal, they start losing interest in things they usually used to like. At some point, they don't even want to associate even with their friends. So most these things I have mentioned is these are signs of mental breakdown. The child could be depressed. The child could be passing through anxiety. So, and once this happens over a long time, it leads to other cases that could lead to complete breakdown, like psychosis. They could start having hallucinations, they could start having suicidal ideations. All these are things that could stem from you ignoring when you find out that your child has become withdrawn. I think the first thing you should notice is once a child is becoming withdrawn. Once a child starts becoming withdrawn, just know that you really, really need to do something about it, because it's either the child is feeling unheard, or the child, yes, it's usually when the child feels unheard. This is the stage that, like I said, they are in a state of confusion. They are asking questions. So when they don't feel heard, they start withdrawing from you because they feel like, oh, you don't care about me. It's either they find solace in their friends, or one uncle who is trying to destroy them, or one auntie that is misleading them. But if there's a responsible adult that is telling them exactly what they should do, you find out that they don't withdraw. But once there's no one helping them, they withdraw completely. And remember, when someone is giving them bad things, bad advice, they tell them hide, oh, hide, oh. So they even still withdraw.
And then don't tell your
And
mommy, don't tell your daddy.
Exactly. So all those things lead to withdrawal. So you should be sensitive once they start withdrawing.
Okay. So parental
Advice. Oh, should I say parental?
Shine your eyes.
Shine your eyes should be there.
Yeah. So intentional parenting is very important.
Yeah.
Parents, please be intentional with your adolescents, girls and boys. All right, Dr. Mims. As we come to a close, what's one sentence you'll tell a teenage girl as she grows?
You are enough. And what you have inside is unique, and it makes you special, and something that cannot be bought by anyone. You are enough. What you have inside is better than what anybody can give you, and cannot be bought by anyone.
Girls, you are enough. Thank you very much, Dr. Miriam Iwanika Ike, for spending time with me on our Body and Mind podcast. Thank you so much for this powerful insights on body image, sex, and mental health in adolescence. It was beautiful having this conversation with you, and hope to see you soon on this show.
No problem. I'm grateful to
Thank you so much.
Just like I mentioned, when I sit down with my family to watch this, I'll be proud.
Yeah. And I'm also proud of you.
Oh, thank you. Thank you very much. Yes.
All right.
Okay.
Thanks for coming.
Yes.
As we come to a close, I want you to pause just for a moment. Take a breath and ask yourself gently, Who taught me how to see my body? Who taught me how to value my body? Who taught me about sex and boundaries? Who taught me about emotions, love, and worth? For many of us, the honest answer is no one really did. We were told what not to do, but not taught why. We were protected with silence instead of empowered with truth. We were left to figure things out alone, often through mistakes, confusion, and a quiet pain. And if that is your story, please hear this clearly. You are not foolish. You are not weak. You are not broken. You were simply uninformed in a world that expected perfection without guidance. This is why a body and mind exists, to break the silence, to replace fear with knowledge, to remind girls and the women they become that their bodies are not objects to be judged, feared, or controlled. Your body is not the problem to solve. Your emotions are not a burden. Your curiosity does not make you bad, and your worth has never been up for debate. To every teenage girl watching or listening, you deserve accurate information. You deserve safe adults. You deserve to ask questions without shame. You deserve boundaries that protect you, not silence that exposes you. To every parent, caregiver, and teacher, conversations don't corrupt children. Silence does. Let's raise girls who are informed, confident, emotionally supported, and grounded in truth, not fear. And remember this, your body is still becoming, your mind is still learning, your story is still unfolding. So, be gentle with yourself. You are not alone, and your journey matters. It's a wrap on season 1, and my heart is full. We are truly grateful for how far we have come on this journey. To all our speakers who lent their powerful voices, their expertise, and their hearts in breaking the silence around adolescent health, thank you. Your contributions have been unforgettable, impactful, and deeply appreciated. To our listeners and viewers, thank you. Thank you for tuning in, for learning, for sharing, and for engaging, and for standing with us in building a healthier, safer, and more informed generation of girls. Your support is the reason this season has been so meaningful. A big thank you to you as well, our podcast crew, the incredible team behind the scenes, and everyone who makes our body and mind possible. Your passion and commitment shine through every episode. And to every single person who has supported us in one way or another, near or far, thank you. Nagode, imela, eshe, imete. May your kindness return to you 100-fold. Don't forget to download your reflective worksheet. Link is in our bio, and it's waiting for you. And if you'd like to share your story, whether on paper, anonymously, live in the studio, or virtually, would love to hear from you. Just send us a message via our body and mind podcast at gmail.com. Season 2 promises to be deeper, bolder, and even more empowering. So stay close, stay connected, and stay expectant. And as always, stay empowered, stay informed, and embrace your body beautifully. Remember this, your body is wise, your mind is powerful, and your journey matters. Until season 2, keep thriving.